Hi, and welcome to Carolina Women. Erin, it is great to see you. We're here today at Lava Fitness, and we have the coolest guest ever, Dr. Annette Callejo. How'd I do? Did I do?
You were great.
Pretty good?
Well. Perfect.
It's good to see you. She is with ROC Dental. We're very excited to talk today about Invisaligns.
Great. Thank you for having me.
Well, it's great. Talk to us a little bit about really how orthodontics and how treating and straightening teeth has changed since you went to Ohio State.
I went to Ohio State. I've been doing orthodontics probably for about 20 years.
Okay.
I've actually done some straight wire braces as well, but when Invisalign came out, it revolutionized orthodontics because it allowed us to treat virtually invisibly malocclusions or crowded teeth, spacing.
What's a malocclusion?
Malocclusion is crowding, spacing, bites are not right.
Okay.
Probably is the best way to describe it. You know, you have a tooth that's kind of sticking out or it's like, you know, kind of crowded in. That's a malocclusion. But it's allowed us to really treat very easily, especially with adults, because they don't want to have the brackets and everything. So it's allowed us to treat them very easily.
So typically if Erin or I would come in and we would say, okay, I'm not pleased with what my smile looks like now as I've gotten older, things are cramped or whatever.
Things start shifting a little bit with age, is that true?
Yes, absolutely.
Yeah.
And we would get a consultation. What would that look like and how would Invisalign play into that?
So basically what would happen is when you'd come in, we're very high tech in that we do a digital scan. So you can see right away what your teeth look like at that moment in 3D.
Oh.
And then we can do a virtual smile design and do a simulation of where we could actually correct it and what it could look like from start to finish.
I love the before and after.
Oh, that's pretty amazing.
It's really amazing.
Are most people candidates, and what's the duration of time for the treatment plan?
Well, most patients are candidates because with Invisalign, it's really evolved over the years. It's really allowed us, before it was just kind of treating very simple cases, but now more complex cases. So really anyone could be a candidate, even from, you know, something that you're having a really big bite issues to say, like if you had a tooth in the front that you're just kind of like really not happy with
Something
the position of that.
You
and then you can just do it very easily and maybe just treat just what you really want versus the entire mouth. That is a possibility, and we can kind of tailor your treatment to what your needs are and what your goals are.
So from a treatment plan point of view, Erin and I might be 6 months, she might be 2 months. I mean, it can be really...
Absolutely.
Okay.
I mean, you know, in general, we say about a year.
Okay.
But that could be shorter or it could be longer, just depending upon the amount of movement that we need to do.
And then sort of, what does it look like? Do we go and put these in during the day?
So this is very typical. So, you know, would be someone's teeth.
Yes.
The aligners, that's what we call them, are a clear... It looks like a retainer.
It does look like a retainer.
Can we whiten while we do this?
You can. Actually, because they're virtually invisible, you can actually put some whitener in there and kind of wear them overnight.
Wow.
You would wear these about 22 hours a day.
Okay.
7 days a week.
Wow.
Take them out to eat?
You take them out to eat, brush and floss.
Okay.
But the more you wear them, it's contact time. So when you're wearing them, they're moving your teeth.
Okay.
And you incrementally change them out anywhere between 7 to 10 days is you would change them. So you'll get a fresh set with the next 7 to 10 days.
And then you're sleeping in them as well?
Sleeping with them.
Oh, wow.
You know, I mean, probably just take them out when you're eating, snacking, that type of thing. But just pop them back in. And most people can't even tell you're wearing them.
What's so funny is
that.
when I first had my Invisaligns, I can't sleep without my aligner.
It's very it's comfortable.
Now it feels almost, it feels like just a necessity to keep it in there.
Right, exactly.
So again, anyone is a candidate for this. What about kids and adolescents? Are they still doing old school braces, or are a lot of the
A lot of kids are doing
adults?
it because they've shied away from doing the brackets because they just don't want to have all that in there.
This is more Instagrammable, let's face it.
Absolutely.
Your daughter has it.
She does, and that was a big selling point for her.
Yes.
She was not going back into silver braces.
Okay.
You know, and like I have 2 children, and when they were in braces, one I had in brackets and one I had in Invisalign, because I knew one was going to be much more compliant wearing them.
Okay.
The other one, I kind of took that control away from him, and you know, because I just knew he wasn't going to be as great as wearing them. But you know, the result is virtually the same.
Well, you're super easy to talk to. It's really fun. Every time we have ROC Dental on, it's really interesting. We learn something.
And 2 locations,
Yes.
Bluffton and Hilton Head.
Yes, correct.
That's
correct.
great. Thank you so much
You're
for joining
welcome.
us. Stay with us. A lot more to come here on Carolina Women.